Master of Ceremonies, shall we bow our heads and pray? Father, we just come before you this afternoon, thanking you for the gift of life. We thank you for the deliberations that are going to take place this afternoon. We thank you that this is going to take us forward as Zimbabwe. And we thank you that everyone in this place is blessed in Jesus' mighty name. Amen.
May I kindly request our honorable minister and the priest to take their seats. Thank you. The guest of honor, allow me to start off with some introductions. On the table, we have our Honorable Deputy Minister of Health, Honorable S.T. Kudini. Honorable Minister, can we put our hands together? We also have the Minister of Finance, Economic Development and Investment Promotion, represented by Ms. T. Chianike. She is around. Thank you. We have our Permanent Secretary for Health and Child Care, Dr. A.G.V. Maunganidze. Yes. We have Excellencies with us this afternoon. We have Swedish Ambassador to Zimbabwe, His Excellency Peter Ente. To Zimbabwe, His excellent job is to Von Kickman, represented by Frank Potter. We have chief directors in the Ministry of Health and Child Care here present, and also the rest of the government in this meeting. We have UN resident in the humanitarian coordinator, RC, Mr. Edward Callon. I heard he's going to his virtual. We have UNFPA representative, Ms. Miranda. The regional director, East and Southern Africa, UNFPA, Mrs. Lisa Sigomo. Yes. Thank you. We have active director, Zimbabwe National Family Planning Council, UNPC, Mrs. Farah Machinga. Thank you. We also have the outgoing national facilitator of the National Youth People's Network on SRHR, HIV/AIDS, Lakmo Banzai. We also have the media here present. Ladies and gentlemen, if I let you, it's not deliberate, but you are really welcome to this meeting. Thank you. May we put our hands and welcome for the meeting. Thank you very much. We are going to have some welcome remarks. From finance? Okay. Yes. We recognize you, Ms. Chianike. You are going to give us some welcome remarks, please. Come forward to the podium. Give us your welcome remarks.
Good afternoon. Thank you very much, Master of Ceremony. Allow me to acknowledge the presence of the Minister of Health and Child Care, Honorable Douglas Mombeshora in absentia, Deputy Minister of Health and Child Care, Honorable S.T. Kudini, Permanent Secretary of Health and Child Care, Dr. A. Maunganidze, Senior Government Officials, European Union Ambassador to Zimbabwe, His Excellency Jobst von Kickman, Sweden Ambassador to Zimbabwe, His Excellency Per Lindgaard, Canada Ambassador to Zimbabwe, His Excellency A. Arist, UNFPA, representative, Mrs. Miranda Tabifo, development partners representatives, CSO representatives, ladies and gentlemen. It is my singular honor to welcome you to this high-level meeting to the country progress review of the implementation of the Program of Action on Population and Development and the launch of the 2024 State of the World Population Report. Your Excellencies, today's meeting will reflect on the progress made in the implementation of the ICPD Program of Action, share successes as well as the lessons learned. Furthermore, this meeting will seek to address the challenges faced by Zimbabwe in the implementation of the ICPD Program of Action and reaffirming Zimbabwe's commitment to the ICPD agenda and positioning for the 2030 Action and Development Agenda. Our distinguished delegates, Zimbabwe, as an African Union member state, is actively implementing the ICPD Program of Action and the Addis Ababa Declaration on Population and Development through the National Development Strategy 1, which came into effect in January 2021 and running through until 2025. Your Excellencies, the NDS-1, which is aligned to both the African Union Agenda 2063 as well as the Sustainable Development Goals, is now in its 4th year of implementation. And it will be succeeded by the NDS-2, which will start from 2026 to 2030. The successful implementation of these two strategic blueprints will see the country achieve its vision of realizing an upper middle income society by 2030. Your Excellencies, the Ministry of Finance, Economic Development and Investment Promotion, as the co-chair of the ICPD Program of Action National Task Force, is in full support of the implementation of the Zimbabwe country-specific commitments made on the ICPD at 25 at the Nairobi Summit. Since the launch of the ICPD National Task Force in 2020, the task force has prepared and submitted the Addis Ababa Declaration on Population and Development report in 2023 and has also carried out progress reviews, with the last review being part of the subject of today's meeting. The Ministry of Finance, Economic Development and Investment Promotion has been responsible for the implementation of a number of commitments from the set of 12 global commitments. Already a national population census was conducted in 2022 and plans are underway to revise the population policy in line with the Nairobi Summit. It is, however, important to note that currently the population policy is being implemented under various policies by different thematic working groups under NDS-1, but there is need to consolidate those policies to come up with a single policy document that combines all the various policies. Your Excellencies, let me take this opportunity to acknowledge the sterling leadership of the Ministry of Health and Child Care as the chair of the National Task Force. I would also like to commend the immense contribution by various stakeholders in the ICPD National Task Force, who include government ministries, departments and agencies, development partners, CSOs, the private sector, and traditional and community leaders. Distinguished delegates, let me also acknowledge the support from UNFPA towards the implementation of various programs directed towards the success of the ICPD program of action. To this end, the country has made commendable progress towards universal sexual reproductive health and rights, creating the necessary financial momentum on the ICPD program of action, and fighting gender-based violence and harmful practices against women and girls. Your Excellencies, at this juncture, let me once again welcome you to this review of the implementation of the Program of Action on Population and Development and launch of the 2024 State of the World Population Report. I wish you fruitful discussions. I thank you.
Thank you, Madam Chianike. We appreciate once more your presentation, being the chair of ICPD Task Force Zimbabwe. Have you seen the theme of this launch? The theme? Okay, let's see the theme. Turning IPCD into reality. Okay, we'll move on. We say it once we proceed. I'm told we also have the virtual presentation which was pre-recorded from Regional Director, East and Southern Africa, NFPA, Mrs. Linda Zibomo, and then we also RRC, Mr. Edward Callum. So, IT, can we have the Regional Director, East and Southern Africa, pre-record?
Honorable guests, esteemed colleagues, mangwanani, ndinotenda nemukana uno wekutaura nemi ndakamirira UNFPA. Good morning. It's a privilege to join you today on this significant occasion. I am filled with pride about my home country and delighted to celebrate with you the remarkable 30-year journey since the adoption of the visionary International Conference on Population and Development, ICPD, Program of Action. This life-changing framework has indeed set a global standard for putting people at the heart of development initiatives. This is a significant milestone that underscores the solid commitment of the government of Zimbabwe to lead and innovate within the ICPD agenda at both regional and national levels. Your efforts are commendable, from hosting the Partners in Population and Development Conference to the submission of the national report for the 10-year review of the Addis Ababa Declaration on Population and Development, and the efforts to increase domestic financing of family planning commodities. These underscore Zimbabwe's role as a pillar of excellence in people-centered development. Reflecting on the last 3 decades, we have witnessed monumental progress across Africa and globally, and these are driven by the ICPD principles of dignity and human rights. This progress is not just historical, it is foundational for the ambitious goals set forth in Africa's Vision 2063 and Zimbabwe's Vision 2030. The Cairo Promise, which envisaged universal access to sexual and reproductive health as a cornerstone of sustainable development, remains as critical and relevant today as ever. The stakes are high, and the cost of inaction is immense, particularly for our most vulnerable populations. I am reminded of Carol Piri, a 43-year-old from the remote Mbire district. She is a survivor of gender-based violence and now a champion for hundreds of women and girls. Her story exemplifies the challenges many women face in our country, the region, and the world, and how our work can transform one life with ripple effects towards hundreds of others. Through collaborations like those spearheaded by UNFPA, the government, and partners, we are actively breaking the cycle of violence, ensuring that survivors in even the most isolated areas receive crucial services and information. Our urgent, concerted action is essential to honor and fulfill the commitments made 30 years ago. Esteemed guests, today we also proudly launch UNFPA's flagship 2024 State of the World Population Report. This year's theme, Interwoven Lives, Threads of Hope, highlights the urgent need to address persistent inequalities in sexual and reproductive health rights to achieve our shared goals. Our world right now is currently facing a complex humanitarian crisis, worsened by climate change, economic instability, and the aftermath of COVID-19. These challenges increase the risk of gender-based violence and hinder access to essential sexual and reproductive health services. This emphasizes the need for our continued commitment to provide support and empowerment. While we have made significant strides, including a dramatic reduction in maternal mortality and the expansion of contraceptive use, the region remains the epicenter of HIV. But Zimbabwe reached its 1990 target, a triumph to celebrate in the region. However, challenges remain, particularly in East and Southern Africa, which continue to face disproportionate impacts from health and gender-based disparities. As we look forward, I call on the government of Zimbabwe to continue its leadership and advocacy in promoting inclusive economic policies, advancing women's and girls' health and rights, and enhancing human capital through critical investments. In partnership, UNFPA is committed to supporting Zimbabwe in its efforts to ensure that every pregnancy is wanted, every childbirth is safe, and every young person's potential is fully realized. We can do this together by strengthening inclusive economic policies and reforms that create decent jobs and empower young people. Women and girls' health and rights, with a focus on reducing the high rates of adolescent pregnancy and child marriage, human capital development through investments in health, including family planning, alongside the school re-entry policy for girls who drop out of school due to pregnancy and child marriage. Dear guests, your leadership will be crucial as we approach key global forums, including the 57th session of the UN Commission on Population and Development and the 2024 Summit of the Future. I eagerly anticipate the outcomes and insights of these high-level meetings. Together, we will continue to strive for a future where every individual's rights and well-being are upheld. Ndatenda, thank you for your commitment, your leadership, and your partnership.
We acknowledge your presentation, Ms. Sigogo. We move on. There's also a recorded video from RC, Mr. Edward Callan.
Distinguished guests, ladies and gentlemen. Today, I am honored to join you virtually at the high-level meeting on ICPD 30 and the launch of the 2024 State of the World Population Report. I would like to express my gratitude to the government of Zimbabwe's leadership and the technical... Excellencies, distinguished guests, ladies and gentlemen. This important gathering. Today, I am honored to join you virtually at the high-level meeting on ICPD 30 and the launch of the 2024 State of the World Population Report. I would like to express my gratitude to the government of Zimbabwe's leadership and the technical support from the United Nations Population Fund in organizing this important gathering. While I would have cherished the opportunity to be with you in person, competing priorities have led me to share my thoughts through this video message. At the historic international conference on population, I eagerly anticipate engaging with you face-to-face in the near future as the topic lies close to my heart and at the core of the UN development system. This moment offers us a chance to assess Zimbabwe's progress, recognize challenges, and recommit to advancing the goals set at the historic international conference on population and development held in Cairo 3 decades ago. The ICPD program of action emphasizes the importance of placing people at the center of sustainable development, advocating for reproductive health, women's empowerment, and gender equality. The 2030 Agenda for Sustainable Development further fortifies these principles, aiming to achieve universal sexual and reproductive health and rights, and by the end of this decade. In the face of significant global trends such as urbanization, migration, climate change, and digitalization, the relevance of the ICPD agenda for the well-being of women, girls, and young people has never been more profound. I commend the government of Zimbabwe for the strides it has taken in advancing the goals of the ICPD program of action over the past 30 years. However, there remains much work ahead, particularly in reducing maternal mortality, enhancing access to quality SRHR services, and combating gender-based violence and harmful practices. To ensure that no one is left behind, it is imperative that we support the government in formulating data-driven policies and strategies to fulfill the objectives of the ICPD agenda, contributing significantly to the 2030 agenda and its 17 SDGs. The current funding levels to support the unfinished agenda of the ICPD in Zimbabwe fall far short of what is needed to address present challenges. I commend the government's efforts in domestic financing for family planning commodities, leading to tangible improvements in the health and well-being of many women and young individuals in Zimbabwe. For instance, through increased access to contraceptives in 2023, nearly 780,000 unintended pregnancies were prevented, along with the prevention of 200,000 unsafe abortions and over 2,000 maternal deaths, a commendable milestone for Zimbabwe. I am informed that the 2024 State of World Population Report will be launched at this event, focusing on interwoven lives, threads of hope, ending inequalities in sexual and reproductive health and rights. This report will shed light on existing inequalities and societal disparities, and will outline policy options to guide future efforts in creating a fairer and more just future for all. I wish you all a fruitful discussion and thank you for your attention.
Minister of Health and Childcare, Honorable Douglas Memboshara, representatives from the ICPD Task Force, Ministry of Finance, Economic and Development, Investment and Promotion, UNFPA Country Representative Miss Miranda Tabifor, Swedish Ambassador to Zimbabwe, His Excellency Per Lindgaard, Canadian Ambassador to Zimbabwe, His Excellency Adler Aristides, other members of the diplomatic corps and UN family here present, government officials, namely the Deputy Minister and PS of the Ministry of Health and Childcare, development partners, representatives of civil society, and members of the media here present, all protocol observed. On behalf of the European Union, I am honored to deliver these solidarity remarks at this important high-level meeting. We commemorate 30 years since the landmark International Conference on Population and Development, ICPD, in Cairo. This anniversary serves as a powerful reminder of the commitment to sexual and reproductive health and rights, SRHR, women's empowerment and gender equality as cornerstones of sustainable development. I want to notably commend the government of Zimbabwe for its progress in implementing the ICPD program of action. The impressive reduction in maternal and child mortality over the past decade is a testament to their commitments. We acknowledge the government of Zimbabwe's domestic investments in procuring contraceptives, leading to one of the highest modern contraceptive prevalence rates in Africa. This, along with the training of health workers in youth-friendly services, demonstrates Zimbabwe's dedication to empowering women and girls. Together with partners like UNFPA, The EU is proud to have contributed to Zimbabwe's sexual and reproductive health and rights and gender equality endeavors, notably with the Health Development Funds from 2016 to 2021 and the Health Resilience Funds from 2022 to 2025. Multi-donor health programs aim at improving primary health care and essential health services. With contribution from the EU, the UK, Sweden and Ireland, and in partnership with the government of Zimbabwe, the HDF played a crucial role in reducing maternal and child mortality rates, enhancing access to SRHR services, including access to contraceptives and critical life-saving equipment, and empowering women and girls. We have also supported training for health workers on youth-friendly services to address the needs of young people. The support is continuing under the current HRF. The EU recognizes the central role of gender equality in achieving SRHR for all. We applaud the mainstreaming of gender in the HRF implementation, ensuring women and girls are effectively represented in health governance and their specific needs are addressed. Under HRF, there have been numerous achievements, too many for me to mention in this short time. They have been won through the hard work, commitment and joint efforts of all the colleagues here today. But our efforts do not end there. Through the Team Europe approach, comprising the EU, its member state agencies and our European Investment Bank, we strive to enhance coordination and coherence in our action to maximize impact. Team Europe, together with Switzerland, has invested over 250 million euros in our Team Europe initiative on gender equality and women's empowerment between 2021 and 2024. The EU's support extends to initiatives like the Global Fund to fight HIV, TB and malaria, where Zimbabwe has received substantial funding, over 200 million euros over the last 2 years, to combat these diseases and eliminate stigma and discrimination. Zimbabwe has made real progress in the fight to end these diseases, and through our support to the Global Fund, the EU is proud to stand by Zimbabwe and its population in the fight against HIV/AIDS, a disease disproportionately affecting women and girls. While we celebrate our achievements, we acknowledge that there is still much work to be done. The health sector faces underfunding and a workforce crisis. Gender inequalities still hinder access to SRHR services for some women and girls, from too many of them. SRHR and gender equality remain an ongoing journey, one that requires unwavering commitment and collaboration. Let us use this opportunity to reflect on our successes, celebrate our victories, and devise strategies to address these challenges together. The EU reaffirms its commitment to supporting Zimbabwe and its people along this journey through ongoing and future assistance, working hand in hand to build a more equitable and prosperous future for all. Together, we can overcome the remaining obstacles and ensure that no one is left behind in our pursuit of inclusive development and gender equality. Thank you, Tatenda.
I know we are from work, but we can do better. We can do better. Thank you, thank you. Let me also, I would like to acknowledge your online participants. There's a lot of online participants. Proceeding with our solidarity remarks, let me acknowledge the President of Sweden, Ambassador to Zimbabwe, His Excellency Per Jan.
The Minister of Health and Childcare, Honorable Douglas Mombeshora, the Deputy Minister of Health, Honorable S.D. Guidini, the PS for Health and other government officials here present, colleagues in the diplomatic corps, the UNFPA representatives of the civil society, ladies and gentlemen, good afternoon to you all. 2024 is a milestone year for the global community as we commemorate the 30th anniversary of the International Conference on Population and Development, ICPD. The ICPD conference held in Cairo in September '94 marked a pivotal moment in the global discourse on population and development. At this landmark conference, 179 member states, including Zimbabwe, agreed to the visionary program of action, which recognized sexual and reproductive health, women empowerment, and gender equality as cornerstones of sustainable development. As we mark 30 years since the ICPD, I would like to commend the government of Zimbabwe for the progress made toward the provision of universal access to sexual and reproductive health information and services. Zimbabwe has seen a considerable decline in fertility rates, maternal mortality rates, and significant increases in modern contraceptive prevalence rate. This is highly commendable. I also commend the government of Zimbabwe together with UNFPA for organizing this high-level meeting to reflect on the progress, address the challenges faced by Zimbabwe in implementing the ICPD program of action, and to reaffirm Zimbabwe's recommitment to the ICPD agenda and the 2030 Agenda for Sustainable Development. Today is a good opportunity to take a fresh look at how we best can sustain the gains so far and further accelerate our progress. We indeed have some challenges that require our continued attention, including high maternal deaths, early marriages and childbearing, limited access to contraception, most especially among young women, inadequate access to maternal health services, higher HIV infection rates, especially among adolescent girls, and indeed when it comes to gender-based violence. We are also witnessing alarming proportions of drugs and substance abuse that are eroding progresses we already made in SRHR. Sweden is committed to the ICPD and remains a champion of SRHR and gender-based violence prevention and mitigation, providing significant financial support and consistently advocating for these issues on the global stage. At ICPD 25 Nairobi Summit, Sweden reaffirmed its commitment to advocating for SRHR for everyone, with a strong focus on marginalized groups, and further emphasized its intention to build even stronger alliances with governments, multilateral organizations, civil society, academia, and the private sector to accelerate the realization of SRHR goals. Sweden is proud to be fulfilling these commitments globally and especially in Zimbabwe. Sweden is a long-standing partner of Zimbabwe, working through various partners. We remain a leading donor on SRHR. Through our bilateral development strategy, we are providing support to more than 10 different projects contributing to SRHR and the reduction of gender-based violence. In addition to our bilateral cooperation, our regional SRHR strategy supports other regional programs that trickle down to Zimbabwe with substantial results. Sweden has a very strong and close relationship with UNFPA. Sweden is consistently among the top donors of flexible support. In addition, we provide support to UNFPA from both global and regional strategies. As I conclude, allow me to take this opportunity to congratulate the UNFPA Zimbabwe and partners for the launch of the 2024 State of the World Population Report. This report, while it reflects on how far we have come in achieving sexual and reproductive health and rights for all, it also highlights the need to bring the promise of ICPD alive for people who have been left behind. It is now indeed a priority to reach also the most marginalized people. A reinforced commitment is needed by all of us in order to leave no one behind. The government of Sweden remains committed to supporting the achievement of the ICPD agenda in Zimbabwe and will continue fostering strong partnerships with the government, UN agencies and civil society actors towards this attainment. Thank you very much.
Thank you, Your Excellency, for the remarks. And also, once again, recognize His Excellency Atla artistically, the Canada ambassador to Zimbabwe, to give us his solidarity remarks. Your Excellency.
Thank you, Director of Ceremonies, Honorable Minister of Health and Child Care, and other government officials, colleague ambassadors, and other members of the diplomatic community, including our friend, the UNFPA country representative, and members of the UNFPA country team, representative of civil society, members of the media, ladies and gentlemen, all protocols observed. I'd like to thank the Ministry of Health and Childcare and the United Nations Population Fund for extending this invitation to me to join you today to express solidarity on behalf of the Government of Canada. I would like to congratulate the Government of Zimbabwe for its progress in implementing the ICPD Program of Action and commend both Zimbabwe and the UNFPA for their accomplishments in implementing the Country Program of Cooperation 2022-2026. The program's goals of ending maternal deaths, ending gender-based violence, meeting family planning needs, and ending HIV infections are fundamental to building a safer and more equitable Zimbabwe for women and girls, and to supporting Zimbabwe to meet its development goals. Canada supports the goal of ensuring that women and girls in all their diversity can decide what to do with their bodies, their lives, and their futures without question. Sexual and reproductive health and rights is a precondition for women's empowerment and a crucial link to all aspects of development. This is why Canada is a lead donor globally in supporting comprehensive sexual and reproductive health and rights as a key element of our feminist international assistance policy. In 2019, Canada made a historic 10-year commitment to improve the health and rights of women and girls around the world. Globally, Canada has committed an average of $1.4 billion a year to improve the health and rights of women and girls, half of which, $700 million, is dedicated to sexual and reproductive health and rights. This commitment was reinforced in Kigali, Rwanda, at the 2023 Women Deliver Conference, one of the world's largest gatherings of gender equality and the health, rights, and well-being of women and girls. Canada announced more than 200 million in funding, including funding to UNFPA at that event. I share these figures to illustrate that Canada is both a donor but also a partner in championing the program of action around the world and also here in Zimbabwe. And we are not alone in this effort, as you just heard from Sweden and the European Union. Today offers a valuable opportunity to reflect on Zimbabwe's progress towards the program of action. We must acknowledge and celebrate the achievements while we reckon with the challenges that remain. Canada stands with the government of Zimbabwe and UNFPA, local civil society, and women's organizations, advocates, activists, private sector enterprises, and international NGOs that are working in collaboration or in their own way here in Zimbabwe to meet our shared goals of zero maternal deaths, zero unmet need for family planning, zero gender-based violence and harmful practices, zero new HIV infections. Tatenda. Thank you. Merci.
Thank you, Your Excellency, for the solidarity remarks. We are proceeding with our program. We are going to have 3 presentations from the Minister of Health, the co-chairs of the Minister of Finance, the outgoing national facilitator, and then later on we have some discussion led by the Executive Director of the National Family Planning. So for now, let me call Dr. Ngontoko to present the achievements, challenges, and lessons learned. Can we welcome her?
A wonderful afternoon to you, ladies and gentlemen. Allow me to ride on the protocols that have already been observed. So I'm going to present on the achievements, challenges, and lessons learned on ICPD. As part of my introduction, ICPD held in Cairo in September 1994 marked a pivotal moment in the global discourse on population and development. More than 179 countries, including Zimbabwe, adopted ICPD program of action, which affirmed the need to prioritize human rights, empower women, and address inequalities within communities. Zimbabwe established a multi-sectorial national ICPD task force to coordinate the implementation of the 12 commitments. The national task force has set up an M&E technical working group which developed an M&E framework to ensure objective monitoring of the implementation progress, monitoring of the commitment started in 2021. The commitments have been reported under 6 thematic areas, which include health, adolescent and young people, gender-based violence, human resources, human rights and peace, humanitarian response, and population and development and data. The commitment number 1 aims to intensify our efforts to the fully effective and accelerated implementation and funding of the ICPD program of action. Key actions for the further implementation of the program of action, the ICPD and Agenda 2030 for Sustainable Development. So under this commitment, we've made some progress. Zimstat conducted a digital population census in 2022 using the computer-assisted personal interview method. For the first time, this enabled the production of the preliminary census results within 3 months of data collection. Commitment number 2 says zero unmet need for family planning information services and universal availability of quality, affordable and safe modern contraceptives, including during humanitarian crisis. In this regard, Zimbabwe has one of the best performing family planning programs in Southern African region, with a modern contraceptive prevalence rate of 67% for currently married women in 2023. And the teenage pregnancy remain a big challenge. 21% of all antenatal bookings made between 2019 and 2022 were for young girls between 10 and 19 years. Commitment number 3, we commit to zero preventable maternal deaths and morbidities such as obstetric fistulas by inter alia, integrating a comprehensive approach of the essential sexual and reproductive health packages, including measures for preventing and avoiding unsafe abortions and post-abortion care into national universal health coverage strategies, policies and programs, and to protect and ensure all individuals' right to bodily integrity and autonomy, and to provide access to essential services in support of this right. Under this commitment, maternal mortality rate has been on the downward trend due to various interventions which have been implemented. And MMR is currently at 362 per 100,000 live births. It was a drop from 525 per 100,000 live births in 2012, according to the census report. Commitment number 4, ensure access for adolescents and youth to comprehensive and age-appropriate information, education, and adolescent-friendly, comprehensive, quality, timely services to be able to make informed choices about their sexuality and reproductive lives, to adequately protect themselves from unintended pregnancies, gender-based violence, sexually transmitted infections, including HIV and AIDS, and to be able to transition safely into adulthood. In this regard, as Zimbabwe, in line with the President's mantra of leaving no one or no place behind, the National Disability Policy was launched in 2021. The policy covers various aspects, including health, education, and accessibility. Commitment number 5, zero sexual and gender-based violence, including zero child, early and forced marriages, as well as zero female genital mutilation, in order to realize all individuals' potentials as agents of change in their society, both socially and economically. So, in this regard, the Zimbabwe Women's Microfinance Bank, Small and Medium Development Corporation, in the 2023 to 2030 National Strategy to prevent and address gender-based violence was launched, and the strategy provides a framework in which the government and other stakeholders will work to prevent, mitigate, and respond to GBV in the coming years. Commitment number 6, using national budget processes, increasing domestic financing, and exploring new and innovative financing instruments and structures to ensure full, effective, and accelerated implementation of the ICPD program of action. In this regard, GOZ demonstrated commitment to domestic funding by signing the Compact of Commitment with UNFP for family planning. In 2022 and 2023, Zimbabwe disbursed a timely sum of $1.5 million each year to ZNFPC for the procurement of family planning commodities. Commitment number 7, doing what is in our power to increase the percentage of official development aid, specifically earmarked to ensure universal access to sexual and reproductive health and rights, to complement domestic funding of sexual and reproductive health programs. In this regard, UN and GOZ signed Zimbabwe United Nations Sustainable Development Cooperation Framework. And in this framework, it seeks to prioritize social protection, health including SRH, climate action and resilience building, gender equality, democratic and economic governance, among other key development priorities. Commitment number 8, harnessing the demographic dividend by investing in adolescent and youth education, employment opportunities and health, including family planning and reproductive health services. So the proportion of youth in decision making rose from 3% in 2021 to 5.2% in 2022, and participation in national development processes rose from 20% to 42%. Commitment number 8, building peaceful, just, and inclusive societies where all people, including the old and the young, people with disabilities, ethnic minorities, and indigenous people, build society where they feel valued and are able to shape their own destiny and contribute to the prosperity of their societies. So the government, in partnership with development partners, launched the Emergency Social Cash Transfer, which aims to provide cash transfer to the vulnerable households. Commitment number 10, provide quality, relevant, timely, and disaggregated data, investing in digital health innovations and improvement of data systems to achieve sustainable development. So the government launched the National Statistical System Development Plan or Strategy running from 2021 to 2025, and it aims to develop national statistical system and the capacity coordinated by ZIMSTAT. Commitment number 11, committing to the notion that nothing about young people's health and well-being can be discussed and decided upon without their meaningful involvement and participation. And the mantra is nothing about us without us. So the Parliament of Zimbabwe launched a new voluntary youth caucus to spearhead the inclusion of youth-related issues in the legislative processes. 23% of youths were consulted in the development processes in 2023, up from 15% in 2020. Commitment number 12, ensuring the basic humanitarian needs of affected populations, including SRH and rights, are addressed as critical components of responses to humanitarian and environmental crises. In this regard, the government of Zimbabwe established the National Disaster Management Center that incorporated Emergency Operations Center, EOC, in 2021. So some of our challenges included inadequate health infrastructure and critical equipment, shortage of essential medicines and health commodities, including blood in health service delivery points, inadequate human resources at health facility level, which is exacerbated by skills flight, limited fiscal space due to economic growth, which has declined from 8.5% in 2021 to 6.5% in 2022. And there are some unforeseen challenges that we came across, such as COVID-19 pandemic, and also including drought and floods. Exchange rate distortions and inflation, which the country's economy is experiencing, are affecting the budget allocations. Also, limited resources to support youth initiatives, gaps in youth-specific research and documentation, media coverage, and skills training, and underrepresentation of youth in positions of influence or power. Inadequate financial and material resources to achieve comprehensive management of emergencies and disasters in Zimbabwe, as well as to enforce the laws. Online gender-based violence through increased use of digital technology has put women and our girls at risk. High levels of unemployment leading people to committing trivial crimes as coping mechanisms. Some of our recommendations include timely release of funds is crucial to effectively utilize the allocated budgets. There is need for a consolidated and updated national population policy that would ensure that population issues are addressed in a coordinated and effective manner. There is a need to expand the parliamentary youth quota to match the percentage of young people in the country's population. Addressing adolescent pregnancies requires a multi-sectoral approach for coordinated efforts and actions including relevant sectors and stakeholders at all levels. There is need to educate the public on new laws, how they interact with religious and traditional belief systems. There is need to recognize the link between environmental degradation, global warming, resource scarcity, and conflict in line with climate change and conflict prevention. Thank you all. That's the end of my presentation.
Thank you, Dr. Gondombo. Reflection from young people in CPD 30 that is Baba Declaration of Population Development and STEM Dialogue is Tilakno and
All right. Thank you very much, Mr. Chairperson, and compliments of the day to you all. Honorable Minister, allow me to write on the already existing protocol. So maybe just to give you a brief overview about Young People's Network on Sexual Reproductive Health, HIV and AIDS. This is a network of adolescents and young people between the ages of 10 to 24 years, which was convened by the National AIDS Council of Zimbabwe with support from Ministry of Health and Child Care, UNFPA and other development partners. So the vision of the network is just to make sure that young people in their diversity, they fully access their sexual reproductive health and rights. But as we speak currently, the Young People's Network on Sexual Reproductive Health, HIV and AIDS is rebranding, not just from focusing on SRHR and HIV, but also adolescent health and well-being. So last year, the Young People's Network on Sexual Reproductive Health, HIV and AIDS, with support from UNFPA Zimbabwe, the National AIDS Council of Zimbabwe, as well as SRHR Africa's Trust, we conducted a 2-day consultative dialogue on ICPD at 30, as well as Addis Ababa Declaration of Population and Development at 10 at Holiday Inn. And we had a total of 50 young people from 21 different sectors across all 10 provinces of the country who participated in this consultative dialogue. So we believe that young people are not a homogeneous group. So we want to make sure that each and every subsector of us as young people is representative. And some of the sectors that were represented included young people living with HIV, young people with disabilities, young people who represent key and vulnerable populations, young people living and working in the streets, among others. So, Honorable Minister, young people, they really acknowledged and they were so grateful of all the work that the government is doing in collaboration with the Ministry of, in collaboration with National AIDS Council, UNFPA and other development partners. But however, because of time, I cannot go through all those achievements which were raised by young people, because the main purpose of this presentation is maybe to highlight what young people identified as reflections or maybe unfinished business. So looking at the commitment number 1, specifically for the AADPD, which speaks about develop, strengthen and implement appropriate legislation, national policies and programs that guarantee and promote human rights, dignity and equality for inclusive and sustainable economic and social development in all sectors. So young people saw that the Zimbabwe's constitution explicitly prohibits same-sex relationships, and our criminal law, the codification and reform, deem certain sexual acts illegal. So these laws result in exclusionary national policies that do not uphold dignity and human rights for all, especially key and vulnerable population. So this key and vulnerable population, they continue to face ongoing stigma and discrimination, which is thereby hindering their access to healthcare, employment, and basic freedoms due to their sexual orientation, as well as criminal laws that are against transmission of HIV, as well as laws targeting these key and vulnerable populations. They actually create barriers for effective HIV prevention, treatment, care, and services. Moving on to commitment number 2, which speaks about develop, strengthen, and implement effective national strategies aimed at eradicating extreme poverty, inclusive growth, and economic development as applicable, that also target disadvantaged groups, especially women, older persons, young people, unemployed persons, people living with HIV, and persons with disabilities in both rural areas and urban areas. So we acknowledge that Zimbabwe has created strategies for poverty alleviation and economic growth for young people, but they are not effectively implemented. So in 2021, young people identified that only 0.8% of the total budget was dedicated to youth empowerment, and many young people, young Zimbabweans are immigrating due to unfulfilled promises and better opportunities abroad. Maybe specifically talking about persons with disabilities, they also lack support from the social welfare department, and it has led persons with disabilities to beg on the streets without health care. As well as adolescent girls and young women, they are also facing structural and social issues which are causing school dropouts and early marriages. In terms of the economic impact, these issues contribute to ongoing poverty, and they hinder economic growth in Zimbabwe. Commitment number 8, just like what the previous speaker presented, young people, they appreciated the youth quota which was initiated by the government, the parliamentary youth caucus, but they also realized that in many boards, in many institutions, including the National AIDS Council Board, the Global Fund, Country Coordinating Mechanism, they lack young people on their boards, despite high infection rates among youth aged 10 to 24. And also we are seeing that older leadership dominates in some of the key institutions. And there is an issue of tokenism, where young people are facing tokenism and manipulation decision-making forums, which silences their voice and limits genuine participation. And we have also realized that young people rarely have the chance to hold leaders accountable, as they are often not allowed to speak or are provided with scripted responses in meetings. Then moving on to commitment number 11, which talks about addressing the causes of high school dropouts among boys and girls while creating a conducive environment to enroll those who have never been to school. In terms of the dropout rates, young people identified that there is high school dropout rates which are not being addressed effectively. Young boys and girls are leaving school due to drug abuse, financial constraints, teenage pregnancies, and child marriages, with a spike in cases post-COVID-19. We also identified an increase in child marriages and teenage pregnancies, and we would also want to appreciate the government for amending the Education Amendment Act in 2020 to foster inclusive and equitable education, particularly for the girl child. So the amendment includes provisions that protect pregnant girls from expulsion, ensure free and compulsory education, and address SRHR issues within the educational framework. But despite these positive changes, young people identified that pregnant girls continue to face stigma and discrimination, which adversely affect their mental health and often results in them not returning to school. So this links with the next commitment, which is commitment number 12, where young people talked about Zimbabwe has introduced a plan to allow these girls to return to school, but the prevailing social norms among families, girls, and educators impede the plan's success because of stigma and discrimination. And young people really raised a point where they highlighted that there is need for community awareness to change the perception and support the readmission law. As well as we have programs that are really helping girls, programs like Dreams and Sister to Sister, which are not widespread, which is leading to the exclusion of many adolescents and girls and young women who are outside the program area. Moving on to commitment number 30, which talks about strengthening health systems down to primary healthcare level towards the provision of equitable universal access to comprehensive range of healthcare services by ensuring sustainable health financing and addressing the critical shortage of resources, including human resources of health and infrastructure. So while available, the primary healthcare is hindered by long walking distance, high user fees, medicine stockhouse, and limited hospital machinery. So young people identified that our government relies heavily on donor funding for health, and as a country we have not yet reached the budget allocation as stipulated by the Abuja Declaration, with only 11.3% of the national budget allocated to this sector. This was for the previous budget. And then in terms of the health personnel exodus, a significant departure of trained healthcare workers has left a shortage of youth-friendly service provider, and young people also raised an issue that there are untrained staff in youth-friendly practices, which is resulting in stigma and discrimination against young people in clinics. Commitment number 32, which talks about create a supportive environment to eliminate preventable, communicable and non-communicable diseases, including HIV and AIDS, STIs, TBs, malaria, and heart-related diseases and cancers. So Zimbabwe has increased efforts to eliminate this, but what young people actually noted is that access to prevention methods in clinics remains challenging due to health workers' attitude, due to legal barriers, in particular the Public Health Act, which restricts under 16s from accessing SRHR services. And young people also noted that young people under the age of 18 often face difficulties obtaining condoms, and they usually end up either buying expensive condoms or not using condoms at all. Commitment number 36, which talk about the integration of SRHR, HIV and AIDS, and family planning. Young people really acknowledge the effort that the government through the ministry have done through introducing the one-stop centers, but they noted that the one-stop centers in Zimbabwe is a great initiative, but it's limited due to provincial capitals, making them less accessible to residents of other areas. So expansion is needed for wider access. Then commitment number 37, eliminate preventable maternal mortality and neonatal mortality through ensuring that births are attended by skilled health personnel, and that there is universal access to prenatal and postnatal care and family planning, emergency obstetric and neonatal care, as well as management of pregnancy-related complications and preventable complications arising from unsafe abortion, in order to protect the health and safeguard the lives of women and adolescent girls and women. Young people noted that due to shortages of health infrastructure, attitudes of health personnel, and preconceived beliefs, many young girls, they shun hospitals and prefer home deliveries, and this actually put them at a risk. Moving on to commitment number 38, on expanding access for all women and adolescent girls to timely, human and compassionate treatment of unsafe abortion complications, and in accordance with national laws and policies, provide access to safe abortion services. So we noted that abortion remains illegal in Zimbabwe, which is leading to significant health risk for adolescent girls and young women who resort to black market pills or dangerous methods like hangers and concoctions for abortions. So we know that post-abortal care is offered in our facilities, but rarely do these adolescent girls and young women seek hospital care post-abortion due to fear of criminal charges. So many undergo unsafe abortion without medical help, which result in severe side effects or fatalities. Commitment number 40, adopt and implement relevant comprehensive sexuality education programs for both in and out of school that are linked to sexual and reproductive health services, with the active involvement of parents, community, traditional, religious and opinion leaders, as well as young people themselves. So we have actually seen that Zimbabwe has implemented a curriculum to support CSEs in school, but this curriculum is not part of the examination, which is actually leading to lower prioritization by teachers, and teachers often choose to teach topics within their comfort zone. So this selective teaching approach is actually resulting in students not receiving the full CSE package, leaving them with knowledge gaps that could be harmful in the long term. Commitment number 72, establish a functional system of civil registration at national, sub-national, community level, using existing traditional and local institutions to ensure the availability of relevant data for planning at all levels. We identified that largely the civil registration system is largely dysfunctional with excessive paperwork. So there is high potential for data loss, especially in health institutions. So specifically talking about young people living with HIV, they are required to carry books to receive medication. So the current system, it actually exacerbates stigma and slows service delivery. And then commitment number 73, which talks about generate, collect, and use quality and timely data from census, surveys, vital and civil registration systems, administrative records, studies, and research disaggregated by sex and population groups for the purpose of planning, monitoring, and evaluation. So we have actually seen that our country have been doing great in conducting census, providing data, but regular surveys and monitoring are often unavailable. Important surveys like ZDHS and MIX have not been produced for several years. If it's ZDHS, the last one was in 2015. I know that the current one is being conducted. The lack of real-time data hinders young people's ability to use evidence-based advocacy with policymakers and programmers. So moving on to commitment number 74, undertake quality and quantitative research and policy studies. We have actually seen that numerous research and policy studies are conducted by various institutions, but they are not easily accessible, especially to young people. And these researches are done, are often too technical, which makes it difficult for young people to interpret and utilize the findings. And especially for those who are young people with disabilities, there is lack of disability-friendly formats, which further limit access for young people in this subgroup. And then commitment number 75, emphasize the importance of collecting data on older persons and persons with disabilities for planning, research to take into account their specific needs in implementing policies and programs. Data disaggregation, so data which is collected in Zimbabwe often lacks disaggregation. It fails to specify if an individual is disabled or the type of disability, and this results in disability-unfriendly healthcare facilities. And then in terms of information access, young people with disabilities, they actually face challenges in accessing this information. And our healthcare workers, they lack training on disability-friendly practice. Honorable Minister, on behalf of adolescents and young people in Zimbabwe, I am pleased to present the distilled essence of our recommendation as a collective voice of the youth for your esteemed consideration as you prepare for the global ICPD conference in New York. So these are our top 5 recommendations that incorporated our critical consent and aspiration. So the first one is that there is need for strengthening youth participation. Our government need to enforce laws and policies that guarantee meaningful youth engagement in governance and decision-making processes. And another important factor is to enhance data collection, whereby we are saying our government, through its partners, need to implement comprehensive data collection methods to address educational and skills gap, gender inequality, and health education resource gaps. And then another recommendation, which is our third recommendation from young people, is to allocate specific budget. So these budgets, they are dedicated budget for SRHR services. And another important issue is to foster domestic resource mobilization through innovative public-private partnerships. And our fourth recommendation is to invest in healthcare, where we need our government and its partners to commit to substantial investment in healthcare infrastructure, ensuring the fulfillment of the Abuja Declaration by allocating 15% of the national budget to health. And our last recommendation is to promote awareness to programs, to support initiatives that inform communities about school-based life skills empowerment and support program, facilitating the reintegration of pregnant, married, or parenting girls into the education system. Thank you.
Thank you very much. Perspective from young people. We move on with our program on time. This conference senior findings. Thank you.
Directors of Ceremony, Minister of Health and Childcare, Honorable Dr. Douglas Mbeshora. Allow me to just repeat the protocol that has already been established, because we are going to an important segment of this high-level meeting, which is a presentation of the 2024 State of the World Population Report. Deputy Minister of Health and Childcare, representative from the Ministry of Finance, Economic Development and Investment Promotion, Permanent Secretary for the Ministry of Health and Childcare, distinguished ambassadors from the Swedish Embassy. We have Ambassador Per Legard, Canada Ambassador to Zimbabwe, His Excellency Adler Aristide, representative of the Ambassador of the EU Commission, Frank Ford. Thank you for coming. Chief Directors here present, our resident coordinator and humanitarian coordinator in absentia on another duty out of the country, Dr. Edward Kalon. Our regional director, Mrs. Lydia Zigomo, also not here with us, but who heard her message to this event. Acting Executive Director of the National Family Planning Council, outgoing facilitator of the National Young People's Network. We've heard you speak. Thank you very much. Our friends from the media fraternity here with us, ladies and gentlemen. We have come to the moment whereby this 2024 State of the World Population Report is supposed to be presented, and it's a privilege for myself as the UNFPA country representative in Zimbabwe, Miranda Tabifor, to present the findings. The report was officially released on the 17th of April last week by our Executive Director, Dr. Natalia Kanem, and the report is online. It is available online, and we also made some copies here in the country. Our teams are going to be sharing the printed versions and the summaries of the report. So the 2024 State of the World Population Report I've seen on the screen. The title is Interwoven Lives, Threads of Hope, Ending Inequalities in Sexual and Reproductive Health and Rights. The report actually focuses on two increasing urgent issues: equity and intersectionality, which, according to the report, they are under attack given the era of polarization that we are actually facing. Inequality is growing. There is counter polarization and misinformation, which is a critical issue that we believe as a UN family is a priority for us. And then the whole issue of solidarity among and across groups that are essential. And I think even in this high-level meeting, we've seen solidarity that has been demonstrated through the presence of our champions, ranging from the government itself leading our ICPD agenda in the country, and then our champions that are donors and development partners that are represented here through the representatives and His Excellencies, the ambassador that we have here today. The 2024 State of the World Population Report is actually structured in segments where we have what we have done well or what we are celebrating since 1994. What is so interesting about the report is that the report is looking at what happened in 2024 or what happened in 2023 being launched this year, but how it is linked to the International Conference on Population and Development Program of Action, this ICPD agenda we are talking about, that is celebrating 30 years today. So according to the report, it's a global report, we have some notable progress. Since 1994, as we see on the screen, over 60 countries have improved access to safe abortion. 160 countries have passed laws against domestic violence. I'm highlighting just a few. The report is available. Unintended pregnancy rate has fallen by nearly 20%. We're talking about a global report. Maybe the situation is not the same in Zimbabwe. Since 2000, maternal death rate has fallen by 34%. Adolescent birth rates have fallen by 1/3. And between 2016 to 2020, the global annual reduction in maternal death was 0. I think that's something that we need to applaud. Please, let's applaud for this. Between 2016 to 2020, we're talking about the global annual reduction. The global annual reduction was 0. And for those of us who have been working with UNFPA, we know that we have an ambitious agenda that we don't want 0 maternal death. No woman should die giving birth. And with regards to that result, it is a critical progress recorded for the SDG indicator number 5.6.1 that is improving. Out of 69 countries, 1/4 of women still cannot make decisions, because we're looking at now what is stalling. We saw the progress, but we know that some aspects or some issues are stalling. What is stalling? What is not working well? According to the report, 1/4 of women still cannot make decisions about their own health care. 1/4 of women cannot say no to sex with their husbands or partner. And nearly 1 in 10 cannot make decisions over whether to use contraceptives. And out of 32 countries, with the data that we have, 40% have seen women's bodily autonomy diminished over time. Ladies and gentlemen, what we are also trying to present here is also, as we see in that caption there, we want to unveil the inequalities. We've looked at the title of the report. It's talking about inequalities, and we're trying to look at highlighting these inequalities that we're talking about. What are they? We looked at the sector where we have our midwives. Our midwives, according to this report, were supplanted by male-dominated medical systems. The midwives globally, I don't know whether it's the same here in Zimbabwe. Our midwives still, in terms of the pay that they receive, we have the gender pay gaps. They have lack of leadership opportunities. There is discrimination and harassment. More midwives deliver care, which could actually avert 41% of maternal deaths. But we are recognizing globally that there is inequality with regards to midwives. And we know the key role that midwives are playing to save lives of our mothers wanting to give birth. There is also the reproduction aspect that has been treated with a lot of radicalization of tools that we have noted in the report. There is misinformation about human reproduction that remains very, very prevalent. We have gender as essentialism, but today we are trying to say, according to this report, we must ensure that the reproductive health systems should be supported, and because they are enablers for human rights for all. That is what the report is saying, and it's a very strong message for all of us. Now, going to counting every stitch, there's a segment in that report that says counting every stitch. And when we talk about counting every stitch, what does that mean? We've heard about data. When we look at the report, why should we count every stitch? In this particular component, we are looking about the criticality and the power of data. At ICPD, that is 30 years ago, member states committed to build better data. Data that is valid, data that is reliable, timely, data that is culturally relevant, internationally comparable data, including gender and ethnicity specific information. But how can we target those that are left behind? In our presentations today, we heard some people are still left behind. And in this particular segment of the report, we're saying that data is important. If we don't have the data, we cannot talk about those who are left behind. So for over 30 years, of course, there is progress in data, We've even heard in the national report here today what data has contributed in Zimbabwe through the censuses and the respective interventions that are going. But in this particular global report, collecting data and disaggregating data by factors can really be important. And if we don't have that, there's a potential issue of excluding very important persons in our population, in our society. Maternal mortality data shows us a powerful example of significant but insufficient progress in terms of data. And the next aspect of the report is women are the threat. If you look at the title of the report, it says we have the element of the thread of hope. So despite the inequalities that the report is talking about, there is the thread of hope, and the report reveals that women are the thread of hope. And when we talk about women being the thread of hope, what do we mean? Why do we say that women are the threads of hope with regards to the issues that the report is addressing, the two issues of equity and intersectionality? Why? The report says women are the thread of hope because when women have control over their fertility, there is huge benefits. We have higher level of education, wider career options, higher earnings are very, very important, and it's potential for us to have that. And above all, when women have control over their fertility, it unlocks a virtuous cycle over generations. So that is the reason why women are the threads of hope moving forward. They will also have the aspect of eliminating gender-based violence. We know the benefits. We have benefits at the individual level. There is productivity at the individual level. There is earning potential. We have reduced in the drugs of economy. We said that intimate partner violence costs 5% of worldwide GDP. And if we have women as thread of hope, 15% of GDP in Sub-Saharan Africa is going to be beneficial. So ending gender-based violence will also be improved because of the reproductive autonomy of women. Then we also have the comprehensive sexuality education, which is associated with increased contraceptive use, reduced adolescent pregnancy rates, improved knowledge and attitudes and communication. And if all this is done, delivered and scaled, the cost is going to be beneficial and is going to drop significantly. All of this, when women are actually considered as the threads of hope with all those benefits, the society as a whole will benefit. And the report says that if we invest $1, if there is investment in $1 in family planning, results in $60 to $100 in the economic growth of the country. Just $1. That is what is going to result at the end of the day for the economy. So, we are talking also now about what about those who are left behind? What are those communities that are left behind? And the recent speaker talked about those who are left behind. Who are they? We know them. We have young people who are left behind. We have people with disabilities who are left behind. We have women, of course. And we believe that for us to have the great potential to unlock these issues of inequalities, we need to actually include and invest in the groups that are left behind. The report further goes that despite the progress we've recorded, we still need collective action. We need solidarity. And the title there says, Weaving Collective Future. It is not by chance that we have solidarity remarks here today at this high-level meeting, because we know that the challenges for the future are enormous. Challenges are enormous. We have climate change that continues to increase. We have inequalities, displacement and migration. We have new SRH issues looming. We have data systems that are lagging. So many challenges for the future. And the report says that we need collective action for the future. And for that, there is need for global solidarity. We have heard the solidarity remarks from our development partners, Sweden, the EU, Canada. SRH investments can reduce maternal mortality, and we need solidarity to get that done. It is possible. Universal health coverage is possible when we do all this together. Global solidarity. Even at the country level, we need solidarity, and this is demonstrated here this afternoon. Data disaggregation is possible. Comprehensive health care is possible. Inclusive care is possible. Expanded access to sexual and reproductive health, knowledge and information is possible. And tailored solutions led by communities are possible and effective. So with the government presence here, contextualizing it in our country, here in Zimbabwe, the government is here present. Our development partners are here, I've already quoted them. The United Nations is here represented. We heard the message from the resident coordinator and those that are connected online. This event is online. With the global solidarity the report is calling for, we can actually unlock the potential of what we are talking about. So on that note, I want to thank you for your attention. Tatenda Shedabonga.
Thank you, Madam Miranda, for the presentation on key findings in the message from the 24th State of World Population Report. We move on. I realize we are now behind time, but we have the task force team, secretariat led by Ms. Farah Machinga, just to in the open discussion in the presentations and some few key findings from the presentations.
Afternoon. Thank you, Director of Ceremonies, Mr. Mukiri. Honorable Minister, Douglas Mabishora, Deputy Minister, PS, Dr. Manganizi, all protocols observed. Because of time, allow me to write on the already spoken protocols. But Honorable Minister, as I was growing up, I yearned to be an ambassador. But then I thought one day I was going to be an ambassador for the young people. But it's no longer possible because of my age. And I said, as I was growing up, I'm still growing up, Honorable Minister. I'm only mature, but still growing up. Now that I can't be an ambassador of the young people, I've paved the way for the other young people because of my generosity. I thought maybe, as for today, Honorable Minister, can I be an ambassador without portfolio? If you allow me, then I will acknowledge all other ambassadors as my colleagues. I acknowledge your presence. My task is going to be very short, and I'm going to ensure that each one of you is going to at least move their jaws. Either you're going to smile, either you're going to share some skills, you're going to ask, or you're going to share input, right? So I'm going to open for plenary with regards to all the remarks and the presentations from the previous speakers. And can I kindly ask if I can have assistance in terms of roving mics so that we quickly just discuss on the presentations. We need it to be summary and we need it to be synthesized. Just like my height, it's a summary of all heights. So we just need to be quick and make it interactive. So at this juncture, I would welcome any contributions, inputs, or reflections to the presentations which we have. You just raise your hand wherever you are, and then the mic will be there. As I'm opening the plenary, I also want to remind you of the turning the ICPD vision into reality is our theme, right? Reflections. Were we praying during the discussion or during the presentation? No reflection. Yes.
All right. Thank you, everyone. My name is Dini Mutata, coming from SRHR Africa Trust. It's not easy to always go first, but it's always simpler because you always say what comes to your mind. I think for me, one of the key reflections that I would like to acknowledge with regards to the ICPD updates, particularly for Zimbabwe, firstly, I would like to acknowledge what the government has done so far. But I think my major concern, or rather something that struck to heart for me, is particularly issues around adolescents. The high issues of 24% around teenage pregnancy. And I just wanted to maybe have a reflection, maybe from the government, to just say what are some of the key achievements, what are some of the key actions that we're doing to reduce this high teenage pregnancy rate? Because again, I acknowledge that earlier on we were talking about 67% of the married women are now on contraception, but of those 67%, how many are adolescents, and what are we doing to still improve the adolescents and the well-being of this particular age group? So I think it's also a conversation just to steer us, get to think in terms of improvement around teenage pregnancies. Thank you.
Thank you. So we want to end inequalities in SRH. I'm going to request few from our partners and also from the Minister of Health to react to some of these questions. Any reflection? I'm here solely for the commitments more and also for positive recommendations so that we move forward. Yes.
Thank you. My name is Pester Sira from Population Services Zimbabwe. Thank you very much for all the presentations which came from the partners as well as the Ministry and the Ministry of Finance. My question is around the financial commitments which have been done so far. We really want to appreciate the government of Zimbabwe for signing the Compact of Agreement as well as committing to financial support for ICPD, making it a reality. But my question is, do we think the financial commitments are really going to help us to reduce all those challenges or the commitments which have been presented? One of them being reduction in maternal mortality. So when the ministry was presenting, they highlighted that our hospital situations are not looking good. The drug situations in hospitals is not looking good. So from the Ministry of Finance, do we think the commitments which have been done so far will be adequate for us to be able to address or make ICP division a reality by 2030? Thank you.
Thank you. So I would like to twist your question into what is it that different we can do or we should do for us to accelerate the implementation of the ICPD agenda. Is that okay? Give me the different strategies and interventions we should do as a country. How best can we make more to accelerate the implementation program of action? I'm also expecting reactions and responses from the plenary as well. I'm not going to engage myself to this item, please. Okay, let me bring it closer so that we can interact all of us. ICPD, let's take it as a weight event where we all need to cooperate as the friends and parents of those who are about to leave. And we need resources to make this event a success. The friends who are like the development partners, the ambassadors, you have to pledge as well. We have, for example, the government are the parents of the planet, and then the partners are the parents of the group. We need to commit ourselves to ICPD agenda. And I would like to have some of the commitments and pledges from you so that we are together and we move together towards the achievement of ICPD agenda. Easy.
So can I have some pledges as well, reaffirmation of the commitment, and then some commitments as well, be it financial or human resources as well, towards the success of ICT development. Everyone will be able to participate, right? Someone from CSOs and the young people. Yes. Thank you. That's the aunt of the one who is waiting. How much are you committing yourselves to ICT people? Thank you. Which also reminds me, commitment number 11, the young outgoing young people I represent talked about. Nothing about us without us. I really acknowledge what you said. Any reactions? In terms of what we are doing to reduce teenage pregnancy, Ms. Pester, can I please challenge you to share some of the initiatives and strategies which we are doing as FP and SRH service providers to reduce teenage pregnancy? Do we have one? Where's the mic?
Thank you, Mr. Machinga. So talking from a service provider perspective, we can talk of access to information and SRH services for the young people, access to the actual services for the young people, and working together with the young people so that they are able to voice what their challenges are and how best we can address them. As I think this was also addressed by Minister of Health when Dr. Gondongwe was presenting on Nothing for Us Without Us, where we have seen the importance of working with young people, those who are at risk of teenage pregnancies. So working with them in all our programming as civil society organizations. Thank you.
You want to respond? Please. The mic.
Thank you so much. My name is Hamida Ismail Mauto, and I'm with Sexual Reproductive Health Africa Trust. And just to, as an addition to Pester's comment, there are three issues that we need to look at as a country, and definitely I congratulate the government, especially the Ministry of Health and Child Care, because I think we've come a long way. But there are three major issues, and when we're looking around adolescents' health and young and well-being, we are looking at issues around accessibility, availability, and affordability. And I think from the UNFPA presentation, she mentioned about if we keep girls in school, we ensure that they have better careers, they have better livelihoods, they have better well-being. So we also need to ensure that young people or adolescents need to participate, they need to be visible, they need to voice out their issues, and they also need to be part of the change. Thank you.
Thank you. And I'm about to give the discussion now. Just the last thing, then we thank you. Mr. Gadon, and then last one.
Thank you very much. My name is Katana. I'm from the Commission we are running soon with Mafia on this one, right? I have to say some initiative. Submission as in terms of accessibility. I want to find out in terms of accessibility, because the world is so fast these days that there are some great changes that happen. I'm taking into account of the new hospital that has been erected, for example, this year. Is the Ministry of Health, for example, taking into cognizance of issues of accessibility before they approve of that health institution? I'm giving you an example. If you have got maybe the Grafio Tower of the United Kingdom, where a 24 building caught fire, and people they died within that incident. Even some of the issues were made by inaccessibility.
Thank you very much. My name is Unat Nyoni, former child president. I represent youth and governance in the Young People's Network. And mine is a reaction and also a reflection. The reaction is to the question, where are the young people? My colleague over here, Dr. Wilson, yes, was talking about how young people have limited resources in terms of spearheading their initiatives. And I was very happy to hear from Dr. L from the National Task Force that they identified that there is a limited resource or limited resources to support young people, and this is enhancing gaps when it comes to youth-specific health services and rights. And I think that is something that we should acknowledge. I think that in itself is a symptom of the lack of youth-specific budgeting as a country and also as a region. I think that it's very important for countries to make sure that our budgets are specific to making sure that young people who spearhead initiatives and interventions have resources at their disposal to do so and to champion the issues of health and well-being within society. Then the reflection is on primary and universal health care. We have Commitment 30, which speaks to strengthening primary healthcare systems, looking into issues of sustainable, equitable, universal healthcare, and doing that through resourcing in terms of human resources and infrastructure. I think that we should talk about mental health care as a component of primary health care. We think that to date people who go through gender-based violence, people who are attacked, who are violated, young people living with HIV, young people with disabilities, etc. When they seek health and services, right, when they seek primary health care, that component of mental health is not included within the accessing of primary health care. We think that there should be will to integrate mental health and psychosocial support into primary health care in and of itself to make sure that people can heal both physically, mentally, and emotionally. Thank you.
Thank you. Okay. I would like to respond to the first question which was talking about involving people with disability. From the onset, if I can say from the word go, when we formulated the National ICPD Task Force, we also ensured that there was representative from persons with a disability. So even on the periodic MNT as well as national task force meetings, we had a representative from persons with a disability sharing skills, challenges, and also recommendations to improve the situations with regards to persons with a disability. And Mr. June, and then I would also like to acknowledge the last presenter. The sentiments from the last presenter, which we also acknowledge in terms of involvement and full participation of the young people. But before I wrap up and share some of the key outcomes from this discussion, can I humbly request PS if you've got any reflections and also some responses to the raised questions. At least from this side you can be able to see me, right?
Yes, thank you. I thought there was a question about accessibility of buildings and if the hospitals are conforming to the requirements for those with disabilities. It is in the inspection manual for all our HPA inspections for hospitals that seek to be open to make sure that our health institutions are accessible for those with disabilities, and there should be amenities, whether admissions and so forth, that are accessible for those with disabilities. If there is any institution that is not conforming, then it should be reported and be rectified. Thank you.
Thank you, Permanent Secretary for Health and Child Care. And I'm hoping that all the questions which you raised have been responded to. If there are any questions which are not yet responded to, I'm going to share with you my email address and my WhatsApp, and then I'll be able to respond later. So at this juncture, Honorable Minister and all the high-level table, allow me to summarize the discussion which we had, and also just to highlight on the key issues which we raised from this discussion. Today we reflect and take stock on how far we have gone in reaching those targets we made years ago. It gives pleasure to see a great commitment and ownership coming from our various partners, and also to see through the promises that we made to people of Zimbabwe. Ladies and gentlemen, I also acknowledge that we still have unfinished business in the country to ensure that we meet key targets of the commitments we made during the Nairobi summit. Let me remind you all that as a country, we are still tirelessly working towards achieving the 3 zeros, which one of the previous speakers talked about. That's zero unmet need for family planning,
zero maternal mortality, as well as zero sexual gender-based violence affecting men, women, and girls. And from the discussion, one thing I also captured is the need for meaningful involvement and participation of adolescents and young people in population and development issues. Let me remind the House that adolescence is a unique and formative time. Physical, emotional, and social changes including, and all these they give exposure to young people in terms of poverty, abuse, gender-based violence. Protecting adolescents from adversity, promoting social, emotional learning and psychological well-being, and ensuring access to services is critical to their well-being. And then number 2, in terms of the key issues which I also captured, Honorable Minister, is the need to increase and strengthen our financing systems to population and development issues. And also reflecting from the last previous remarks, I think it was from Ambassador of Canada, who then emphasized that in Canada they have managed to mobilize $1.4 billion per year towards population and development, 700 million towards SRH financing, and as Zimbabwe, this is also what we need to do, ensuring that we are committing ourselves in terms of financing. I want to applaud the government of Zimbabwe. For the past 2 years, they've managed to also allocate 3 million towards procurement of contraceptives, which is one of the key issues which needs a round of applause. Not only that, but through the partnership and collaboration with the UNFPA, government of Zimbabwe has also managed to sign the Compact of Commitment. And with this one, if I can also talk about it, that for every amount which we also invest in family planning, we also get double of that amount through the match funding, and this is through the collaboration with the UNFPA. Then lastly is about partnership, collaboration, and networking, which is key in terms of achieving the ICPD 30 agenda. And through that strong partnership and collaboration, we will be able to mobilize resources towards achieving the ICPD agenda. And Honorable Minister, allow me to also inform you that a few weeks ago, we were able, as Zimbabwe, to conduct a smart advocacy meeting, which is also key as a country in terms of advocating for more domestic financing, as well as even international financing towards the ICPD 30 agenda. And this was with support from UNFPA and FP 2030. And let me also, as I conclude, remind each one of us that if you want to go fast, go alone. And if you want us to go far, let's move as a team. Together we will achieve it, and together we will make it. It is also my hope that, Honorable Minister, the discussion from this plenary is also going to enrich your presentation during the ICPD 57 session. And we must work together with agents and take advantage of every opportunity to achieve the inclusive, equitable, and sustainable vision of the ICPD 30 agenda. And as an outgoing Master of Ceremony, please a round of applause for me as I sit.
Thank you, Ms. Machinga, for steering the debate. I think we had good comments, reflections on the presentation. We also kindly request the Secretariat to share the presentation to the invited delegates, excellencies, and all other delegates you have invited. The time we're waiting for is now, where I'm going to invite our Honorable Deputy Minister, Honorable S.T. Bitim, to introduce the guest of honor.
Thank you once more again, the Director of Ceremony. Let me recognize the presence of our guest of honor, who is the Minister of Health and Child Care, Honorable Dr. DT Mombeshora. For the sake of time, because I've seen we are behind time on our program, let me observe the already protocol observed before, such that we move with time. The person whom I want to introduce here is the person who is also in the mantra, as it's been said by the last speaker, to say if you want to go far, move with others. So he's the one who is leading to the ministry with partners who are here, including the UNFPA, such that in all developmental aspects we want, especially in health aspects in Zimbabwe, he's also an approachable man to make it happen in Zimbabwe. So he's a man who has got vast experience in this field, especially in health sector. So most of them we have met him, and for the few who haven't met him, you are lucky today that you are going to be with him and to hear his original voice. Some they have seen him in television, some they have heard him saying, but today we are going to see him. He's a doctor by profession. He rose to those ranks, or to that rank which he holds now, all along in a good manner, which is recommended by the country. That's why he was chosen to be the Minister of Health by the President. I thank you, Honorable Minister. Can take this floor. This is your time.
Good afternoon to you all. I take it that we are still attentive, because you know, when you speak last after such a long session, some are thinking of going home and some are now observing their eyelids from inside. But anyway, let me start by recognizing our Deputy Minister, Honorable Kwedini, our Permanent Secretary in the Ministry of Health and Child Care, Dr. Maunganidze, representative from Ministry of Finance, Economic Development, Investment Promotion, Ms. T. Chianike, our ambassadors for Sweden, Canada, and the European Union, all senior staff from various ministries here present, ladies and gentlemen. It is a pleasure today for me to be part of this high-level meeting on the International Conference on Population and Development, which is coined ICPD, and launched the 2024 State of the World Population Report. Almost 30 years after the landmark ICPD conference in Cairo, where we set out to achieve a world in which people lived longer, healthier lives, and enjoyed more rights and choices than ever before, we have gathered today to take stock, celebrate our achievements, and reflect on the unfinished business of ICPD. The ICPD fits hand in glove with many of our key national strategies, such as the National Development Strategy, NDS1, and the National Health Strategy. It calls for women's reproductive health and rights to take center stage in national and global development efforts. It also recognizes that reproductive health and women's empowerment are intertwined, and that both are necessary for the advancement of our society. Today, we stand proud as Zimbabwe, as we have been able to score some key achievements on our ICPD commitments. Allow me to recap a few of the major achievements as heard from previous speakers. Zimbabwe reduced maternal mortality from 651 in 2010 to 362 deaths per 100,000 live births in 2022. In simple terms, this means we have reduced the number of women dying due to pregnancy and childbirth related issues from about 7 to 4 per day. But this is still too high. No woman should die whilst giving birth. This is a major achievement and is a result of government and its partners investing in strengthening the health system in Zimbabwe, and is also an affirmation to our commitment to ensure that no women should die whilst giving life. We need to continue in this positive trajectory. The government has stepped up budget allocation for family planning as part of increasing financing for contraceptives using our domestic resources. We have invested USD 3 million in the last 2 years and have already started procurement of contraceptives for this year. As a result of government commitment and investment, Zimbabwe became the first country under the UNFPA Supplies Global Partnership to receive match funding to complement government's investment in family planning as a recognition of investment done by the government. We will continue using national budget processes, increasing domestic financing, and exploring new and innovative financing mechanisms to ensure full, effective, and accelerated implementation of the ICPD program of action. The government is currently working on a national health insurance scheme, and this will ensure that we reduce catastrophic health spending by our people. Ladies and gentlemen, we, however, are cognizant that we still have some unfinished business. As you may be aware, we are currently grappling with the problem of high adolescent pregnancy. More needs to be done for the adolescent and youth, who constitute the bulk of our population, so that we are also able to harness the demographic dividend. Investment in education, health, social development, and promoting youth engagement in relevant development and economic issues is paramount. Clearly, we cannot operate in silos, as a multi-sectoral approach is needed. All hands should be on the deck. Of late, we have been hit by natural disasters. Cyclone Idai, COVID-19 pandemic, currently cholera outbreak, and also we are facing El Nino induced drought. We therefore need to continuously work on strengthening our emergency preparedness and response. Government has put in place legal enabling statutes which include Civil Protection Act, the Public Health Act, and Environmental Management Act, among others, to create a conducive environment for disaster risk reduction initiatives and for a comprehensive and strategic approach to climate change adaptation, mitigation, financing, and environmental education. Let us take advantage of this as we strengthen our emergency preparedness and response and build a resilient health system. We cannot talk about ICPD without talking about the population, as the two cannot be separated. It is therefore very apt or befitting that today, as we reflect on our ICPD journey, we are also launching the 2024 State of World Population Report. The State of the World Population Report is published every year. It covers and analyzes developments and trends in world population and demographics, as well as shedding light on specific population issues and unique challenges we face as the global community. The theme for this year's State of World Population Report is, open quote, interwoven lives, threads of hope, ending inequalities in sexual reproductive health and rights, close quote. While we have made enormous strides in fulfilling the ICPD agenda, globally, millions are still denied their health and rights every day, something that can and must be ended. Around 800 women still die every day while giving birth globally. And sadly, nearly every one of these deaths is preventable. Most of these deaths are in developing countries. Between 2016 and 2020, the global annual reduction in maternal death was effectively zero. So you can see as Zimbabwe, we've done reasonably well on the fight to reduce maternal mortality. Women and girls with disabilities are up to 10 times more likely to experience gender-based violence, including sexual violence. Investments in gender equality and in sexual and reproductive health and rights are essential to securing a more just future. Spending $79 billion on family planning and maternal health is estimated to save 1 million women from maternal death between 2022 and 2050 globally, and also yield about $660 billion in economic benefits. As Zimbabwe, we relate to this. In 2023, 2.1 million women were using modern contraceptives in Zimbabwe. And as a result of contraceptive use, a total of 2,200 maternal deaths were averted. In addition, an evaluation done by the Ministry of Health, Zimbabwe National Family Planning, and partners a decade ago showed that as a result of family planning, Zimbabwe was saving $14.2 million per year in the cost of providing maternal and child health care. The evaluation also estimated that achieving family planning goals had the capacity to increase Zimbabwe's GDP per capita by 22%. The State of World Population Report cites that closing the global gender gap in the public, private, and social sectors is projected to add $12 trillion to global gross domestic product and ending intimate partner violence, which is believed to cost the world 5% of the GDP. This would result in immediate and long-term benefits to productivity and earnings, with impacts cascading across generations. But the world is not sufficiently investing in gender equality, empowering women, or saving their lives. To ensure that the next 30 years of progress includes everyone, we must pivot towards providing comprehensive, universal, and inclusive sexual and reproductive health care and guaranteeing rights for all, regardless of their background. This means designing tailored and targeted health programs that address the multiple ways economic, social, political, and environmental justice impact people's health and rights. It also means moving beyond measuring human experiences in broad average and committing to the collection of disaggregated data across a variety of factors. As we launch the State of the World Population Report, let us celebrate our achievements as a country and continue to reflect and push on the unfinished business. Together we can make it. With these remarks, I officially launch the 2024 State of the World Population Report. I thank you.
Here we go. So going to be given to distribute to the VIP. The minister is going to distribute. Thank you. We are coming to the end, and hopefully also nice presentation
Thank you. You sound very tired, Mr. Mjiri. Towards the end there, I am sure it's a reflection of how everyone is probably feeling after a long day. And I'm not going to waste much of your time, but this is quite important that we give a vote of thanks for all the efforts that have been put and all the zeal to make sure that the commitments that were made are fully activated. I observe all the protocol that has already been observed. Honorable Minister, allow me to observe that. Ladies and gentlemen, I'm delighted that Zimbabwe has done it again and achieved a big milestone in just holding this high-level meeting where all of us as key stakeholders are and have exchanged on the country's achievements and how to accelerate progress in the areas lagging behind. I really want to thank the guest of honor, our Honorable Minister, for taking his time to just be here. If any of you were aware of the events of the last 3-4 days, you would understand why I had to thank him first. We believe that the exchanges of this afternoon, which have been superintended by our principal, have provided a sound background for our participation in the upcoming CPD 57 conference in New York. I would like to express my deep appreciation to our lead ministry, the Minister of Finance, Economic Development and Investment Promotion, who have really worked tirelessly to coordinate all the sectors over the years to ensure that we have our national progress reports and more critically that Zimbabwe remains a key example in the region and the continent for all the successes there. I would want to express also my sincere gratitude to the ICPD National Task Force, the organizers of this workshop, Ministry of Health and Child Care, UNFPA, and that task force which I have mentioned in partnership with the UNFPA, making sure that we are here together. The facilitators and presenters, for all your insightful contributions, I thank you. And of course, the participants for the active engagement and the valuable inputs that will take us far. I particularly want to thank our development partners, the ambassadors. We have come in person to make sure they witness and also launch with us this 2024 State of the World Population Report in Zimbabwe. Your Excellencies, I'm very grateful. Ladies and gentlemen, I think we definitely have to progress on to reflect on the progress, but we have definitely identified the areas of successes and challenges, and we should commit now to continuing to accelerate the progress that is needed to achieve our goals. We need to continue working together to ensure that every individual has access to quality education, healthcare, and economic opportunities. Let's prioritize our women, our girls, and young people, and address the persistent inequalities that hinder our progress. And domestic financing has to be at the core of all our activities and efforts. The meaningful inclusion of young people were among the key messages that emerged from today's discussions held in this room. So we need to include them. Those with disabilities, we need to include them. We need to explore how to increase financing in the critical areas. I think, as has been said, together we'll go far. So let's work together towards a Zimbabwe where every individual can thrive and reach their full potential. I thank you all, and have a good evening. Thank you.
Thank you, please, for the closing remarks. I think this brings to the end of our meeting. I'm told that the Honorable Minister team, for you and the Excellencies in your brief room. The rest of us, we remain seated while the Minister departs to the brief room. There's also tea in the brief class. The VIP protocol, the unit, the Honorable Minister to the President and the